Medicaid is a lifeline for millions of vulnerable Americans, low-income families, children, the elderly, and people with disabilities. For many, it's the only way to access essential medical care, from routine checkups to life-saving treatments. Without Medicaid, countless people would be left to face illness and injury alone, unable to afford the care they desperately need. It's built on trust and compassion, funded by taxpayers, to ensure health isn't determined by wealth. The program is a promise that no matter your background or bank account, you won't be denied care when you need it most. This safety net is a cornerstone of our society, reflecting our collective commitment to care for one another. But the program's vast scale makes it a target for fraud, with devastating consequences. The sheer size and complexity of Medicaid create opportunities for those willing to exploit the system, often slipping through the cracks. Tintekken da krag, on the bearer, sitaten, or detten I, and akungurend, for regulation. Every stolen dollar is one less for a sick child or an elderly parent in need. When funds are diverted by fraud, real people suffer, treatments are delayed, medications go unfilled, and families are left with impossible choices. Abuse erodes public trust and threatens the very people Medicaid was created to protect. When the system is abused, it undermines faith in the program and makes it harder for those in genuine need to get help. Fraud often starts small, in local schemes, but can grow unchecked for years. What begins as a minor deception can spiral into a network of corruption, draining resources from communities that rely on Medicaid the most. Uncovering these crimes takes courage, often from insiders risking everything to speak out. Whistleblowers face retaliation, isolation, and personal loss, but their bravery is essential to exposing wrongdoing and protecting the vulnerable. Today we focus on Ohio, where a whistleblower alleges a massive long-running Medicaid fraud siphoning millions from those in need. The case has sent shockwaves through the state, raising urgent questions about oversight and accountability. This is a story of systemic weakness, alleged criminal activity, and the urgent need for accountability. It's a wake-up call for policymakers, healthcare providers, and the public alike. At its core, it's about a system meant to help, now being systematically harmed. The stakes are high, and the need for vigilance and reform has never been greater. In Ohio, attorney Mehek Cook has blown the whistle on what she calls a deeply entrenched Medicaid fraud scheme. Cook says the fraud has drained millions over more than a decade, with insiders from the Somali community coming forward to expose it. They describe a widespread, organized effort to exploit a specific Medicaid benefit, coaching people to fake conditions for home healthcare payments. Cook claims up to 99% of recipients in this scheme are coached to deceive. If true, this would be one of Ohio's largest Medicaid frauds, with losses mounting year after year. Cook warns that Ohio's Medicaid system is especially vulnerable, urging officials to investigate beyond the paperwork. The central claim built on trust has been betrayed, and without action, the theft will continue. Ohio's scandal echoes a recent, massive fraud in Minnesota's child nutrition program. Mehek Cook draws a direct line between the two, warning that Minnesota's case is just the tip of the spear. She suggests Ohio's Medicaid fraud may be even more extensive, and that similar tactics are spreading wherever oversight is weak. These schemes often involve networks of insiders, falsified documents, and complicit partners. The core issue, public funds meant for compassion, are being systematically stolen. Cook's warning is clear. These aren't isolated incidents, but symptoms of a national vulnerability. If fraud can flourish in both Minnesota and Ohio, where else is it happening? The tip of the spear analogy is a call for a broader, coordinated investigation into our social safety nets. The alleged Ohio fraud takes advantage of a specific Medicaid rule that allows family members to be compensated for providing home health care services. This rule was designed to help families care for loved ones in need, but in this case, it's being twisted for personal gain. The fraudsters have found a way to turn a compassionate policy into a lucrative scheme. The scheme begins with individuals being coached on how to fake or exaggerate medical conditions. They're taught exactly what symptoms to describe, and how to convince a doctor that they need ongoing care. even if they're perfectly healthy. Sometimes doctors are misled or even complicit, signing off on care plans that aren't truly necessary. Once the paperwork is approved, a family member steps in as the official caregiver. In some cases, these caregivers can receive up to $91,000 a year from Medicaid, all while the so-called patient continues to live a normal, healthy life. The money flows in, unchecked, as long as the paperwork looks legitimate. When this process is repeated across a network of participants, the impact is staggering. Dozens, even hundreds of people can be involved, each siphoning off thousands of dollars. In total, millions of taxpayer dollars are drained from Medicaid, money that was meant to support those truly in need. The operation is highly organized. Recruiters actively seek out new participants, sometimes targeting vulnerable communities. They provide detailed instructions, from what symptoms to claim to how to fill out the forms. Every step is carefully managed to avoid detection. The paperwork itself is meticulously prepared, with official stamps, signatures, and medical jargon. It's nearly impossible for outsiders to spot the fraud. Everything appears above board, making it extremely difficult for investigators to catch. The Medicaid system sees a doctor's diagnosis and a caregiver's claim and processes the payment as if it were any other legitimate case. There's little reason to suspect anything is amiss. All of this fraud is hidden behind a wall of seemingly legitimate documentation. The sheer volume of paperwork and the complexity of the system make it easy for fraudulent claims to slip through unnoticed. The real tragedy is that this manipulation diverts critical resources away from people with genuine health needs. Every dollar stolen is a dollar not spent on someone who truly needs care. This isn't just a case of a few bad actors, it's a sophisticated, well-coordinated operation that exploits the very systems meant to protect the vulnerable, making it one of the most challenging types of fraud to uncover and stop. The scheme's linchpin is the complicity of medical professionals. Some doctors allegedly rubber-stamp fake diagnoses in exchange for kickbacks, betraying their oath and the public trust. Their signatures make fraudulent claims appear legitimate, making it nearly impossible for state administrators to detect the scam. This breach of ethics not only enables theft, but undermines faith in the entire medical profession. When doctors are implicated, it casts doubt on all legitimate care. The system's reliance on physician trust is its greatest vulnerability. Once a doctor signs off, claims are rarely questioned. This creates a paper trail that conceals the crime in plain sight. The consequences go beyond financial loss. They erode trust in healthcare itself. The very people meant to protect health are, in some cases, helping to exploit it. Exposing this kind of fraud is dangerous. Insiders face real fear of retaliation. Those who approached Cook did so at great personal risk, fearing not just social ostracism, but physical harm. In tight-knit communities, being labeled a traitor can mean losing your livelihood, your safety, or your place in society. This culture of fear silences honest people and protects criminal networks. The criminals exploit these dynamics, ensuring whistleblowers stay quiet. Despite this, some insiders bravely spoke out, desperate to stop the exploitation of their community and Medicaid. Their courage highlights the seriousness and organization of the alleged fraud. This is not a victimless crime, it's a calculated operation, protected by intimidation and silence. It's vital to distinguish between criminals and the broader Somali community in Ohio. Mayhek Cook stresses the issue is with a small group exploiting Medicaid, not the community as a whole. Most community members are honest, hardworking, and rely on public institutions for support. The criminals not only steal from taxpayers but betray their own community's trust and reputation. They use cultural ties to recruit and conceal their schemes, but their actions don't represent the majority. Many within the community are actively trying to stop the fraud, recognizing the harm it causes. Investigations must target individuals and networks responsible, not stigmatize the entire community. Blaming everyone is unjust and counterproductive, making it harder to build trust and cooperation. The goal: root out criminals, not stigmatize a community. The fraud thrives because of glaring gaps in Medicaid oversight. The system relies too heavily on doctors' initial assessments, with few checks to verify if care is truly needed or provided. There's a lack of random, unannounced home visits, simple steps that could expose fraud. Some bedridden recipients are seen active on social media, yet still receive benefits. As long as paperwork is in order, payments are approved, and the network exploits this weakness. Without robust audits and real-world verification, the state can't distinguish real claims from fake ones. This lack of oversight invites fraud, making the system easy to game. Ohio's situation is a warning. Even well-intentioned programs can be drained without strong safeguards. The response must be swift and thorough, beginning with a comprehensive independent audit of Ohio's Medicaid home healthcare program. This isn't just about reviewing numbers on a page, it's about digging deep to understand how the system is being used and misused at every level. Only by shining a light on every aspect of the program can we identify where the cracks have formed and how fraudsters have slipped through. Audits should go beyond paperwork, verifying claims in the real world, to uncover the full scope of fraud. Inspectors must visit homes, speak with patients, and confirm that services billed are actually being delivered. This hands-on approach is crucial to reveal the true extent of abuse and to protect those who rely on these services. Mehek Cook urges similar reviews nationwide, as these vulnerabilities likely exist elsewhere. She emphasizes that Ohio is not alone. Other states may be facing the same risks, often hidden beneath layers of bureaucracy and trust. Nationwide audits would help close loopholes before they're exploited on a larger scale. By proactively searching for weaknesses, states can prevent future fraud and save billions in taxpayer dollars. Reform is essential. States must move beyond trust and paperwork, implementing independent medical assessments and more frequent home visits. These steps ensure that only those who truly qualify receive care, and that services are delivered as promised. Technology and data analytics can flag suspicious claims for review. Advanced software can spot unusual billing patterns, alerting investigators to potential fraud much faster than traditional methods. The goal is clear: stop abuse, hold criminals accountable, and restore integrity to Medicaid. Law enforcement and the justice system must work hand in hand with healthcare officials to ensure consequences for those who exploit the system. Reforms must protect genuine beneficiaries who depend on the program. For many, Medicaid is a lifeline, providing essential care that allows them to live with dignity and independence. By strengthening oversight, we ensure Medicaid serves those truly in need. Oversight committees and caseworkers play a vital role in maintaining the program's integrity and making sure help reaches the right people. Ohio's revelations are a wake-up call, demanding renewed commitment to accountability and public trust. The time for action is now, to safeguard Medicaid for future generations and restore faith in a system meant to serve the most vulnerable.